Hi there. My name is Bronwyn Perez, and my faith and ethics paper was on nursing ethics. So, just to go into some of like the introduction portion and then into the key highlights. So, overall, my paper kind of looked at core ethical issues that a lot of nurses will face in their practice. A lot of the common themes that I saw through my research and through my interviews were around end of life discussions, patient autonomy, and then family involvement. Um, and I kind of saw that again with my research, the interviews that I did, and then I've seen it through working and then also some clinicals that I've seen. So some key points and highlights that I just wanted to share. The biggest kind of ethical dilemma that I saw through all of my research was life-sustaining treatments versus end-of-life care. This is relevant in a lot of different areas of nursing. Two of the nurses that I interviewed were a type of intensive care unit nurse, so they had a lot of insight on this because they see this quite often. But a lot of the research that I did talked about how to balance life-sustaining treatments versus shifting to end-of-life care and how that decision can be quite challenging. Um, and as a nurse, you kind of have to be there to help educate and guide the family through either continuing or withdrawing the treatment. And through all of that, you want to be respecting patient dignity and quality of life. Um, and there's many ethical principles that go into guiding these really difficult conversations. Like I said, patient autonomy through all of ethical decisions in nursing is super important because um, there's a lot of different values and beliefs that people have. So you want to make sure that you're tailoring to that person with good communication. And the nurse kind of acts as a mediator for patients and their families, and can even act as an advocate to the provider if maybe the provider is not quite listening to what the patient wants. But it's super important to honor the patient's values and their legal rights, and just being like that kind of middle ground for everybody. And then some of the resources and committees that nurses get to work with are ethics committees that are within a hospital or the organization that they work for. These committees are often used in complex situations, and they can basically help provide guidance of what to do in a complex situation. This can be anything from patient rights, medical treatments, shifting from end of life care or life sustaining treatment to end of life care, helping with cultural accommodations, anything really that can bring in ethics. They're helpful. Um, and ultimately, these committees help the patients to make informed decisions about what they would like to do for themselves. The biggest impact for me through all of this was just learning how others integrate their faith into their work because it's not something that I feel like I'm very good at. Um, so some ways that I kind of learned throughout this process to integrate faith into nursing practice is to just be demonstrating compassion, integrity, and respect for every patient. Um, Integrating faith doesn't necessarily mean pushing your values and beliefs on everybody, but just treating others the way that Jesus did. So that could be offering spiritual support like a chaplain to a patient, or if appropriate, maybe prayer directly from you as the nurse. And just like that holistic environment is really important. Patients are often there for either physical or mental health needs, but we also need to remember to take care of their emotional health and their spiritual health. And that faith can kind of be a foundation to how we go about helping our patients and just like communicating with them and even driving our ethics forward. I also found it really interesting how you can use faith to handle moral distress and emotional burnout that nurses often can face. Working in healthcare is quite challenging, so having that good foundation of faith can help to kind of take on that moral distress, and just kind of challenging situations that you might occur. or run into. Um, so anything like prayer or listening to worship music on your way to work or from work or during a break, if you get one, can kind of help balance finding like the work-life balance and just how to overall find comfort and purpose in your work as a nurse. And then finally, my plan for transitioning from a student to a professional. Um, I really want to seek mentorship from others of how to integrate my faith into my work. And that can be through other nurses that have years of experience, committing to continuing education. And then also when I'm at work, but also not at work, making sure that I'm utilizing prayer and reflection. And that will just help to ensure that I'm living the Christian values that I would like to live by. While still doing my job as a professional. So overall, ethical nursing, it requires a huge balance. Um, and it also requires integrating your faith into your practice, which overall leads to more compassion and resilience, and just creating a better nurse for yourself by integrating that faith in.